Hi there, this is Anna Dolopo, and today I'm going to present my 111th video for my acupuncture practice and Chinese medical practice, Elements in Harmony Acupuncture and Chinese Herbs. My website is elementsinharmonyacupuncture.com. I've been in practice since 1999. Today I will be discussing brain hemorrhage and migraines. I received a wonderful testimonial just a few days ago, 2011. November 11, 2020, and it is currently November 22. And I just want to read this to you and give you my tell you exactly what the dates were. I'm going to post this at elementsinharmonyacupuncture.com. The URL is /brain, elementsinharmonyacupuncture.com/brain, so you can read it there. So this is from Laura, and I'm going to read the testimonial, and then I'm going to tell you exactly how many treatments she received, so you know what she had to go through in order to heal from this. And so let me go ahead and read this to you, and I'll give you the exact dates too. I have been going to Anna since February. I highly recommend her for acupuncture. I started seeing her because I started to have migraines one day. I never had them before. My doctor told me that sometimes that just happens, and then you have to live with it. I didn't accept that. Living with migraines is not living. I would later find out it was due to a brain hemorrhage, but from the moment I met with Anna, she gave me hope that I would not have to live with it. She knew she could help, and she could see I needed it. My eyes told the story of the pain I was living with. They had become bloodshot red from the pain. I started aggressive treatment in February, and after a few treatments, I could tell it was helping. It was like she was able to turn down the dial down from the pain. It would take months before I would be migraine-free, but I made it, and it was largely due to Anna's help. Once I found out the cause, she was able to adjust treatments to consider the brain hemorrhage. The doctors were not able to do anything really except pain meds that didn't work. I don't think I would be where I am today without her help. I am still going to Anna and will keep going because I have improved from her treatments, and I think she can continue to help me heal and stay healthy. Definitely go see her for pain. Again, that's elementsinharmonyacupuncture.com/brain, and I'll tell you the exact dates that she received treatments. From the moment she posted this, she had received 45 treatments from April 25 until November 14. I'll tell you how many, treatments per month she had received, so you get a clear idea of what she had to do in order to heal. April 25 was her first treatment. May she received 12 treatments, so she was coming 3 times a week. And then June, she received 10. July, she received 9 treatments. August, she received 6 treatments. September, she received 3 treatments. October, she received 2. And November, she received 2. So I want to detail in this video exactly how many times she came in. It's important to understand that the beginning phase of easy cases is those first 10 treatments. The beginning phase of chronic severe issues, and we're talking about a migraine here, and brain hemorrhage. So this is a severe issue. This is a chronic issue. This didn't just happen. There was something that was going on underneath. So the beginning phase for chronic issues, difficult issues, is the first 20 treatments. She was starting to see tremendous results by treatment 20, but she didn't write the testimonial until the 45th treatment. So April 25 was her first treatment. Then she received 12 in May. May 1, May 4, 6, 7, 12, 15, 16, 19, 21, 23, 25, 26, May 30. So actually, I think it was 13. So let me just repeat that. May 1, 6, 7, 12, 15, 16, 19, 21, 23, 25, 26, 30. Yes, there were 12. And then June, she received 10. June 2, 6, June 6, 9, 13, 16, 20, 23, 27, and 30. She received 10 in June. Then July 9 she received 9. She came in on July 3. I worked Independence Day in the morning. She came in on Independence Day. 7, 11, 14, 18, 21, 25, 28. She came in 9 times. And then August, she received 6. You can see how she went from, she got the 1 in August, then April, then 12, 10, 9, and then she tapered down to 6 in August. August, she received on August 1st, 4, 8, 15, 22, 29. Then September, she received 3. September 5, 12, 19. In October, she received 2, the 13th and the 24th. And it is currently November 22. She received a treatment on November 3 and 14. So she's starting to come in every other week, which means that, I live by a little saying, which is if I'm not seeing my patients and they love me, no news is good news. So I just want to really share with you that the beginning phase for chronic severe issues is those first 20 treatments. If you're one of my students, or if you're a patient, or if you're trying to understand how acupuncture works, especially when it comes to migraines. I told this patient, Laura, at the very beginning, one of my favorite things to treat is headaches and migraines. One of my favorite things to treat, because in my opinion, and I've been in practice for 21 years, migraines and headaches are not the disease. That's the manifestation of something else going on. And in this case, she found out that there's a brain hemorrhage. So I was able to, kind of modify things in order to tailor to that new finding. Her initial neurologist was very condescending to her, and he told her to stop doing acupuncture because acupuncture was just a spa treatment and just making her feel good, but it wasn't going to heal her. She said she wanted to punch him in the face because he made her feel undermined. He did not make her feel valuable as a patient, and it was not a very good interaction. She felt like it was really poor bedside manners. In fact, I discussed this in my video, Bell's Palsy and 25 Other Topics, where I got extremely heated up. I was angry. Keep in mind, I do a bunch of videos, and I've never gotten that angry ever. I got extremely angry in this video. And so I just want to share with medical doctors, I respect you, I respect your field, but if you're talking to patients and they're telling you that they're getting results from something that you may or may not agree with, you might want to listen to your patients, because this matters to her. Chinese medicine matters to her. Anyways, she now has a new neurologist. This one's a woman. The previous one was a man, and this woman's very supportive. She feels supported. She feels like the doctor understands her. The doctor supports her. And in the healing field, when we're in the business of helping patients feel better, live healthier, higher quality lives, that's all that matters, is us being able to reach out to our patients and listen. What is it that you need? What can I bring to the table? Why are you here to see me? Because in the field of Chinese medicine, there are hundreds of acupuncturists in Orange County. I don't know exactly how many, but if you Yelp us, there are a lot of us. I think what brings my work to the table really well to patients is that I'm very clear and upfront. You'll see that from many patients' testimonials, that I'm very pretty clear and upfront with my expectations of you as patients. If these are your expectations of me, if you go under once a week, and I share this in 5 accountability videos, if you go under once a week, don't expect anything. Expect nothing. If you go once a week, I expect 30 to 70% improvement in 2 to 4 months. If you come 2 to 6 times a week, I want to see 30 to 80% improvement in the first 2 to 6 weeks. When you graduate, when you get to 100%, you go another 2 weeks at 100%. That's 4 weeks at 100%. Then once a month for 5 to 9 months. This is something that took me a long time to fully understand. This is my 21st year in practice. I think I really didn't start saying this so deliberately, so fluidly, until I want to say 12 to 15 years in practice. It took me a long time. I've been doing acupuncture since '99. I've been doing balance method acupuncture since 2006. My initial training is like every other acupuncturist on the planet. Traditional Chinese medicine, which has been around since 1959. Balance method acupuncture, the style that I do is from the late Grandmaster Dr. Richard Tefutan, and he taught me a classical style of acupuncture that I use day in and day out, that I use for headaches and migraines, fertility tremendously well, autoimmune issues. I did a video on lupus. I get all kinds of case studies, so I don't want to, go into that. But I just want to let people know that the style that a practitioner uses does matter. I no longer do TCM. I have nothing against TCM, but my success rate with TCM was 40 to 60%. My success rate with balance method is 90-95% when people follow the protocol. So I hope that this video has been very helpful. If you know of anyone that's suffering from brain hemorrhage, but especially from migraines and headaches, this can work very well with whatever your neurologist is doing. It does take a lot of treatments, and it does take time. Why she has a brain hemorrhage, she never revealed to me. I think that's for the the MRI to reveal itself. The doctors never told her, but all I know is that this is how the patient feels, and you can heal. It will just take time. So just like with anything severe, it's just going to take time and a lot of therapy. So I hope you have a great day. Oh, my website is elementsinharmonyacupuncture.com. My office landline is 949-305-1703. My text is 619-341-4341. If I'm not available to you because I live too far, I practice too far from where you live, then there are so many acupuncturists around the world who are very competent, very effective. I just hope that this message reaches out to a lot of people who think that they don't have any alternatives than to just, like what that first neurologist told my patient, it didn't seem as if she had any hope. But fortunately, we were able to make some great results happen, and I'm truly blessed and truly happy to be a part of her healing journey. All right, take care. Have a great, great day.